Hi guys, Dr. Timur is here. In the next 10 minutes we're going to break down the truth about omega-3, how it works, why you're probably not getting enough, and what's it doing in your brain every single day. Let's get started. Omega-3s are essential fatty acids, meaning your body can't make them on its own. You need to get them from food or supplements. There are three main types: ALA, EPA, DHA. ALA comes from plant foods like flax seeds or chia. EPA and DHA come from fatty fish, krill or sea-based sources. But here's the catch. Your body converts only a small amount of ALA into EPA and DHA, just 1 to 5%. And that's not enough to support your brain or body. That's why I don't recommend ALA supplements. A little from diet is okay, but supplementation not needed. The real benefits come from EPA and DHA, the active forms your body can use right away. Let's talk about why this topic really matters. Omega-3 deficiency is more common than most people realize. Studies show that up to 80% of people in Western countries are not getting enough EPA and DHA. Vegans and vegetarians are especially at risk since they avoid the best sources like fish and eggs. Pregnant women, older adults and people with chronic inflammation also tend to have low levels. And here's another layer. Even if you take a supplement, not all omega-3 are absorbed the same way. Forms like ethyl esters are harder to absorb unless taken with a high-fat meal. And as we age, our ability to process and use omega-3 declines. So it's not just about popping a capsule, it's about giving your brain what it actually needs. If you've ever skipped fish for weeks, hit like. You're probably not alone. Your brain is made up of about 60% fat, and DHA is one of the key components. It forms the cell membranes in your neurons, helping signals move faster and more smoothly. When you're low in DHA, your brain becomes slower, less focused, and more prone to dysfunction. DHA also supports memory, stable emotions, healthy neurotransmitters. This is not a small detail, it's a foundational to how your brain functions every day. DHA is essential for brain development in babies and children. Low levels in early life have been linked to development delays, learning disorders, behavioral issues. Even ADHD symptoms have been associated with omega-3 deficiency. Pregnant and breastfeeding women need higher DHA levels to support their baby's brain growth.
Yeah, it looks like you are pregnant. About 8 or 9 weeks, I'd say. Congratulations.
This is one of the few nutrients where timing is critical. Get it right early. This one is personal for many people. EPA, one of the main omega-3s, had been shown in studies to reduce symptoms of anxiety and depression.
It's not a heart attack.
You don't know that.
It's a panic attack.
It lowers inflammation in the brain, which is increasingly linked to mood disorders. Patients often report more emotional stability, less irritability, a calmer, clearer mind. It's not magic, but it's powerful support. Want to stay sharp as you age? Omega-3s help with attention, processing speed, working memory. They've been studied in both healthy adults and older population, with results showing better cognitive performance in people with higher omega-3 levels. Think of it as long-term maintenance for your brain. If you want to keep your mind clear at any age, hit subscribe now. We talk about these things all the time. Low-grade chronic inflammation is linked to nearly every major disease, from heart problems to metabolic issues and even Alzheimer's. Omega-3 acts like an anti-inflammatory signal. It reduces key markers like C-reactive protein, interleukin-6, TNF-alpha, and it brings the immune system back to balance. It doesn't suppress, it modulates, and that's what you want. Heart disease are still the #1 killer, and omega-3 plays a role in protection.
Okay, fine.
Does your chest hurt?
It can lower triglycerides, raise HDL, the good cholesterol, improve blood vessel flexibility. In some studies, high-dose EPA has reduced cardiovascular events in people with high risk. It's not a replacement for lifestyle changes, but it's a valuable ally for your heart. Emerging research showed that EPA and DHA may help people undergoing cancer treatment. It's been shown to preserve lean body mass, reduce fatigue, and even improve response on chemo. Again, it's not a treatment, but a supportive strategy with minimal downside. And for some patients, it makes a noticeable difference in how they feel during therapy. Your retina contains high levels of DHA, and that's not a coincidence. Omega-3 supports visual clarity, night vision, retinal health. Some studies link DHA to reduce risk of macular degeneration as you age, and this is why many eye supplements included.
Legolas, what do your elf eyes see?
The Uruk's turn northeast!
If you ever struggled with dry eyes or blurry vision, comment below. I'd love to know your experience. Let's keep it simple. Best omega-3 foods: salmon, mackerel, sardines, anchovies, herring. These fatty fish are rich in EPA and DHA. Avoid high mercury fish like swordfish or king mackerel. If you don't eat fish, krill oil or algae-based soft gels are your alternatives. Just check the label for real EPA and DHA content. And skip omega-369 blends. They're often marketing fluff. You don't need extra 6 or 9. Stick to pure omega-3 from marine sources. Let me tell you about Jess. She's 37, works in finance, came to me with brain fog, low mood and irritability. She's exercised, slept well and ate clean, but something was missing. Her omega-3 index 3.2%, well below optimal. We added 2 grams daily of high-quality EPA and DHA taken with lunch. In 6 weeks, her focus and energy came back. Mood stabilized, brain fog gone. It wasn't overnight, but it worked. Here's the general advice. 1000 to 2000 mg combined EPA and DHA daily. If you have high cardiovascular or brain demands, 3000 to 4000 under professional supervision. Always take it with food, preferably a fatty meal, and check your label. If it says ethyl ester, it's harder to absorb unless paired with a big fat source. Look for triglyceride or re-esterified triglyceride form if possible. If you like short health tips, follow my Instagram page. It's a lot of information there. Here's what I do. I take omega-3 every morning with breakfast. 2 soft gels of high EPA, high DHA formula. But I also take it with vitamin D and magnesium, because these 3 works together to improve brain function and lower inflammation. If you're curious about magnesium, I explain everything about it in my previous video. Check it out after this one. This combo keeps my focus sharp, mood balanced and performance where it should be. Thanks for watching and see you in the next one.